Okay, hello. It's very nice to meet you. My name is Monica Dorsey. I'll be your social worker and caseworker for the evening. My name is Monica. I work for Tori. And I wanted you to know that I'm so happy that you're here with me. So can you, I want to introduce this practice setting. This is actually for a class, but I really just wanted to, get your permission of being able to use this information for my class assignment. Is that okay with you?
Yes, ma'am.
Okay, awesome. So one, tell me your name.
My name is Tanya G.
Tanya G. Nice to meet you, Tanya G. Tanya G, we'll be doing your assessment here on ShareTag, which is an instrument tool that is used for our clients here at Tori, which we do previously incarcerated women and men. And so we're going to do a healthcare assessment with you so that I can see where you are physically, emotionally, and mentally. It's super important that we gauge what goals you have for yourself so that we can get your treatment planning and your intervention process going here at Tori so that we can get successful outcomes for you within the next 6 months of your time here in the program, okay? Also, I just wanted you to know, just for clarification, I'll be asking you a series of questions. If you ever get stumped or you don't feel like answering it, please let me know if you feel uncomfortable. I'll be taking notes as we go along. And so let's start, okay? So, Miss Tanya, do you have health care insurance or a primary care physician?
No, ma'am, I don't.
You don't? Okay. All right. Um, and have you always been living here in Dallas?
For the last 5 years.
For the last 5 years. Got it. All right. Um, do you receive any regular medical checkups, or when was the last checkup you had?
I try to go to the doctor, but sometimes I can't afford it. So I will say, but it's been about 2 years since I had a checkup.
Okay, gotcha. It's been about 2 years. All right. Do you have a dentist here in the area that you go to?
No, I usually try to just go as I need, as the need arises. I don't have a primary dentist, but I do sometimes use the Care Parkland, their
Parkland.
dentist.
Okay, gotcha. It's county. All right. And when was the last time you saw the dentist?
It was about a year and a half ago.
Okay. Okay. And are you currently pregnant, or when is the due date?
No, I'm not pregnant. I have two children. They're 15 and 14.
All right. What's their
Well,
names?
my 14-year-old just turned 14, and my 15-year-old is they're about 17 months apart.
Okay. What's their names?
My oldest is named James, and my youngest is named Timothy.
Oh, I love that. I love that. I'm sure they're great kids.
Yeah, I'm pretty proud of them.
Yeah, I'm sure you are. Are you in any immediate need of any medical services right now?
No, well, sometimes I have some problems with my foot, my left foot. Sometimes when I walk, I get some pains from my foot, and it causes me to sometimes miss, sometimes trying to find a job.
Okay, so are you currently employed or unemployed right now?
Right now, I work part time at a cleaner's.
Okay, got it. And which cleaners is that?
I work in a cleaner's is right off of Quart Road in North Dallas.
What's the name of it?
It's called Timothy Cleaners.
Okay, got it. And how much do you get paid an hour?
Usually, if I work 20 hours, I usually get like $8 an hour. So sometimes I can bring home about 150 a week.
Okay, okay, got it. All right. So do you have heart disease, asthma, or high blood pressure?
No, ma'am, I don't have any. I haven't had any problems with those diseases.
Okay. Do you have diabetes, HIV, and AIDS?
No, ma'am.
All right. Have you ever had a substance abuse problem?
No, I haven't. No, ma'am.
You haven't? Okay. Okay. Um, so, There is some things that I wanted to talk to you about that are on your background. I see possession of controlled substances. I know that you know you may not have a problem right now. Was there ever a point in time in history where you did struggle with that?
Well, I say I don't have a problem now, but about 10 years ago, I had got stopped because I had a friend that was in the car with me, and I let him be in the car with me, and I was had some drugs when we was going to sell them to try to make some money.
Okay, okay, gotcha, gotcha. All right. According to the screen right here, it says that you also have a felony that deals with delivery of controlled substances.
Yes, that was the time when I had my friend in the car with me, and then when I was stopped by the police, we had some um, drugs that we shouldn't have had in the car with us.
Okay, okay,
But I really don't feel I have a problem. My friend at that point in time was really the one that was the medicine belonged to.
okay. Got it, got it. And so I know that you said that you don't have a problem anymore earlier. What age did you start using?
Well, I really say that I didn't really start using, although it's I always had bad company. There have been a time since you pressing me about it. There have been a time when I was 19 years old that I did use for a little while, but I wouldn't say I'm hooked on it. I would say I just have bad. I always tend to have bad company, and either they have it with them, but I just kind of feel that I'm just always in the wrong place.
Okay, okay, gotcha. Um, so tell me this. What was your drug of choice?
Well, when I did use it, which was years back, I used to love marijuana.
Okay, got it. And did you ever use any other drugs? Any other drugs with the marijuana?
No, ma'am.
Okay. All right. Thank you for your transparency. Are you currently taking any medications right now?
No, ma'am.
Okay. Have you ever been hospitalized or in any inpatient program for mental health issues?
No, ma'am.
Okay. All right. I see here in your charts that you have been to MetroCare and have been evaluated through MetroCare. When was your last time that you were evaluated through MetroCare?
Well, they just made me go there because when I was put in jail, when the police stopped me and they said drugs, and then the social worker came in the jail and he talked to me and said, "Do you feel like you have a problem?" And I thought in my mind, if I say yeah, they would give me the help that I need, and I could get out of jail sooner. So I did visit with a mental health worker right after I got discharged from the jail.
Okay, awesome. Um, all right, so tell me this. You were evaluated right after you were released. What did they give you any diagnosis?
No, they just said that I have to make better choices
Okay.
and to follow up with them in 6 months.
Okay, so has it been 6 months since your release?
Oh yeah, it's been a couple of years.
Okay, got it, got it. So one thing that I would advise is that in order for you to stay in the program, we do have to know your diagnosis. So we do advise that you go to MetroCare, right there off of Keys. In Dallas and get reevaluated. It is free for them to evaluate you. Once you get your diagnosis, if you could take a picture of it and send it to me via email so that I can document it on this side so that we can properly serve you.
Okay. I don't know if they're gonna come up with a diagnosis, but I do need you guys' help. But uh, to me, I just make bad choices and have bad company.
Mm-hmm.
But I will meet with them to see how they can help me.
Mm-hmm. Got it. Got it. That's good. That's good. Well, the first step is being willing, right? Being willing to say, you know what, I want help, right? I want help and I want to see what they can do. And so, what they'll do is they'll assess you. After they assess you, they'll diagnose you. And after they diagnose you, they'll prescribe your medications for you to go pick them up. So that's basically how it works. It's nothing to be scared of or anxious about. They're very nice.
I hope I don't have to take any medicine.
Yeah, yeah. Well, we'll see for sure. We'll see when you get there and allow the psychiatrist to diagnose you. We trust their experience. And the beauty about it is that that's the first step towards a better you, right? A better you mentally, emotionally, and physically. And so we want to make sure that we're starting off on the right foot, right? Um, can you tell me this? Have you ever been abused or any type of abusive situation?
No.
No? Okay. Are you currently experiencing depression, sadness, hopelessness, loss of interest, difficulty with daily functioning, anything like that?
No.
No? Okay. Are any anxiety, any hallucinations?
No.
Okay. Any trouble understanding or remembering things?
No.
Okay. Have you ever had a thought of suicide?
No.
Okay. All right. When you were in jail, did they diagnose you with any type of mental illnesses?
No.
No. All right. Okay, well, that concludes this assessment. Thank you so much for all of your assisting, and thank you so much for your help in this assessment. I want you to know that you are worthy of a fresh start. And also, I want to discuss your next steps. Your first next step is to go to Metro Care and be evaluated. And then your second step is to email me your diagnosis. And then upon our next appointment, which will be in 2 weeks, on March the 8th, we will go ahead and start doing your treatment planning as well as your goal intervention. So we want to make sure that we're setting goals and we're also obtaining them, okay? Um, I just want you to know, thank you for coming in. It was such a pleasure meeting you, Miss Tanya, and you have a great day, okay?
I really appreciate your time, ma'am.
You're very welcome. All right.